Hi, I'm Dr. Sanket Mehta, Surgical Oncologist from SSO Cancer Center. In this video, I'll walk you through everything you need to know about fibrolamellar liver cancer, a rare form of liver cancer that affects young adults and is very different from the typical liver cancers we often hear about. Whether you're a patient or a caregiver or just trying to understand this rare disease better, this video is meant to guide you in simple, clear terms. So let's begin. Fibrolamellar liver cancer or fibrolamellar hepatocellular carcinoma is a rare type of liver tumor. It can affect people of various ages, though it is often observed in younger, healthier individuals. It's different from regular liver cancer because it occurs in people who do not have cirrhosis, hepatitis, or chronic liver disease. It's not related to alcohol, smoking, or fatty liver. It looks different under a microscope with a thick fibrous layer. That's where the name fibrolamellar comes from. This is not just a variant of liver cancer, it's a distinct disease and it behaves differently. This type of cancer tends to appear in otherwise healthy young people, often without any risk factors. Scientists have discovered a specific gene fusion involved between the DNA JV1 and the PRKACA genes. This fusion leads to abnormal cell growth in the liver, causing this malignancy. But it is not inherited, it does not run in families, and there is nothing a person can do to prevent it. It's a spontaneous mutation which makes it especially difficult to predict. Because fibrolamellar cancer often grows silently, it's sometimes found accidentally during scans. When the symptoms appear, they may include a dull ache or pain in the right upper abdomen, feeling of fullness and a lump under the ribs, loss of appetite, nausea and weight loss, fatigue or low energy. In rare cases, even jaundice when the skin turns yellow. These symptoms are common to many conditions, but if they persist, it's best to check with a doctor. To diagnose fibrolamellar cancer, doctors often use imaging like CT scan, MRI to visualize the tumor. Blood test. Interestingly, most patients have normal AFP levels. This is a tumor marker that is often raised in the regular type of HCCs. Biopsy. A small sample of the tumor is taken to confirm the diagnosis. Because this is a rare tumor, it's critical that diagnosis is reviewed by experts, ideally in a center that does liver cancer regularly. There are a few misunderstandings I would like to clear up. No, it's not caused by junk food, screen time, or stress. It is also not contagious. And while healthy living is important, no diet or lifestyle causes or cures this cancer. This is a rare biological event, not anybody's fault. Fibrolamellar liver cancer can be cured, especially when caught early. The most effective treatment is surgical removal of the tumor. This is called as liver resection, where we remove the tumor and the tumor-bearing area of the liver while leaving behind adequate healthy liver tissue. Interestingly, this tumor tends to grow to large sizes, sometimes even as big as 20 centimeters, without spreading to other organs. So even in such cases, it can still be treated and potentially cured. Here is what you should know. Surgery offers the best chance at long-term survival. The liver can regenerate, so most people recover very well after surgery. In some cases, if surgery is not possible right away, we may try other treatments to either shrink the tumor or increase the size of the residual or the future liver remnant. This may include portal vein embolization, where we block the blood supply to the tumor-bearing area of the liver to cause hypertrophy of the remaining liver. Chemotherapy, though fibrolamellar HCC doesn't always respond well to standard chemotherapy. And we also have the option of clinical trials for new targeted therapies which are under research. In rare cases, liver transplant may also be considered. Treatment decisions are best made by a multidisciplinary team, including surgeons, oncologists, radiologists, and pathologists. After surgery, patients typically undergo regular follow-ups every 3 to 6 months. This includes blood tests, imaging like CT or MRI, and physical checkups. This helps us detect any recurrence early, which can sometimes be treated with another surgery or even loco-regional treatment like ablation. Many patients return to full activity over time, but they do need long-term monitoring. If fibrolamellar HCC comes back, it's understandably frightening, but not the end of the road. Options include repeat surgery if possible, targeted therapy under clinical trials, radiation or ablation for smaller lesions, or a combination of these treatments. Every case is different, and that is why specialist input is so important. Fibrolamellar HCCs usually occur in people with otherwise healthy livers. And because of their relatively good biological behavior, they often stay confined to the liver even when they grow to very large sizes. What that means is, if the tumor is detected at a reasonable size, we can often remove it using laparoscopic or minimal invasive surgery. Smaller cuts, faster recovery, shorter hospital stay, and the patient can get back to their normal lives sooner. Not every surgeon is trained in laparoscopic liver surgery, so seeking specialized care at a specialized center is what really matters. Being diagnosed with a rare cancer can feel isolating, but you are not alone. There are support groups focused on fibrolamellar HCCs. Online forums, caregiver communities, and rare cancer organizations can also help. And emotionally, it's okay to feel overwhelmed. Seek support, ask questions. Don't hesitate to talk to your medical team. The medical community is actively researching fibrolamellar HCC. DNA JV1 PRK ACA gene fusion has opened new pathways for drug development. International databases and clinical trials are already improving our understanding. Young researchers and patient foundations are pushing for progress. In short, we are learning more every year, and that gives us hope for a better future ahead. If you have been diagnosed with fibrolamellar HCC or even just a liver tumor that seems unclear, it's absolutely okay to get a second opinion because this is rare. Not all doctors have experience with it. Seeing a specialist team can make a big difference in the diagnosis and the treatment options. Fibrolamellar liver cancer is rare but treatable, especially if diagnosed early. It isn't linked to lifestyle and often occurs in people without liver disease. While it can affect younger patients, many patients we see are often in their 40s and 50s. Surgery is the cornerstone of treatment and long-term follow-up is important. There's real hope and research is moving forward. If this video helped you understand the condition better, please consider liking, sharing or subscribing, not just for updates but to help spread awareness to others who may be searching for answers. And always, if you or your loved one are facing this, please talk to your oncologist. The right information, the right team and early decisions can make all the difference. Thank you for watching.